Today's top stories. Congenital ichthyosis tied to risk for allergic disorders. How pharmacists can strengthen drug safety monitoring. Acromegaly-associated diabetes tied to cardiovascular issues. NOACs tied to slower cognitive decline in comorbid AF and AD. AI stethoscopes may aid early CVD detection. AI adoption soars among UK GPs. But confidence doesn't. Glofitamab-GemOx shows sustained survival benefit in DLBCL. GP advice service linked to incidents of patient harm. GLP-1 patient with a belching problem. Singing may help and stat plus. Amylyx endocrine drug succeeds in pivotal study. We start with congenital ichthyosis tied to risk for allergic disorders. Congenital ichthyosis tied to risk for allergic disorders. TOPLINE patients with congenital ichthyosis have higher rates of allergic rhinitis, food allergy, and allergic asthma than those in the general population, with more than 2/3 reporting at least one atopic condition. Methodology: researchers surveyed 115 children or adults with physician-confirmed congenital ichthyosis in the U.S. between 2024 and 2025, or their caregivers. Patients had various subtypes of the skin disorder, including lamellar ichthyosis, congenital ichthyosiform erythroderma, and X-linked ichthyosis. Data from 8 patients with Netherton syndrome were analyzed separately because of the known risk for atopy with that condition. The researchers compared the rate of allergic conditions in this population with those in age-matched individuals in the general population, using data from the 2021 National Health Interview Survey. Takeaway: overall, 68.2% of patients with congenital ichthyosis, excluding Netherton syndrome, had at least one allergic condition compared with 27.2%, 31.8% of age-matched individuals in the general population. The rates of allergic conditions were highest among patients with the most erythrodermic subtypes, such as ichthyosis with. How pharmacists can strengthen drug safety monitoring. Adverse reaction reports are communications submitted by healthcare professionals, patients, or other healthcare-related parties to report the occurrence of an unwanted effect associated with the use of a medication, medical device, or treatment. These reports are part of pharmacovigilance systems, whose objective is to collect, analyze, and evaluate information on the safety of medicines once they are available to the public. Although medicines undergo rigorous clinical trials before being marketed, some adverse effects are only detected when they are used in real-world conditions and in a much larger number of patients. For this reason, spontaneous reporting remains an essential tool for ensuring their safe use. For pharmacists, reporting suspected adverse reactions is an important part of their patient care duties. Thanks to their accessibility and close relationship with patients, as well as their ongoing monitoring of treatments, they are in a unique position to detect potential medication-related problems, even before the patient consults other healthcare professionals. Which reactions should be reported? One of the most common questions is which cases should be reported. Acromegaly-associated diabetes tied to cardiovascular issues. TOPLINE patients with acromegaly-associated diabetes had a higher risk for cardiovascular morbidity than those with type 2 diabetes, T2D, which was mainly driven by venous thromboembolism, pulmonary embolism, and arrhythmia. Methodology: researchers in Sweden conducted a nationwide, observational, matched cohort study by linking multiple Swedish health and administrative registries to compare mortality, morbidity, and treatment patterns between patients with acromegaly-associated diabetes, and those with T2D. Patients were considered to have acromegaly-associated diabetes if they had both a documented diagnosis of acromegaly and evidence of diabetes. Either a formal diagnosis in the National Diabetes Registry or a filled prescription for a glucose-lowering medication. A total of 348 patients with acromegaly-associated diabetes, mean age, 60.3 years. 51% women were included and matched 10:1 with 3480 control patients with T2D, mean age, 59.5 years. 51% women. The mean follow-up duration was around 9 years for both the cohorts. Primary outcomes were risks for overall and cardiovascular mortality in patients with acromegaly-associated diabetes versus control individuals with T. NOACs tied to slower cognitive decline in comorbid AF and AD. Non-vitamin K oral anticoagulant, NOAC. Use was associated with modestly slower cognitive decline among older adults with comorbid atrial fibrillation, AF, and Alzheimer's disease, AD. According to the results of a nationwide Swedish study among more than 7,000 adults, the annual decline in mini-mental state examination scores was 0.23 points smaller with NOAC use versus no anticoagulant use, and 0.21 points less than with warfarin use. NOAC use was also associated with lower risks for all-cause mortality, ischemic stroke or systemic embolism, and fracture compared with no anticoagulation, without a significant increase in major bleeding. Although the difference in MMSE scores was modest, it increased over time, with mean scores at 5 years of 15.3 among NOAC users compared with 14.3 among those not receiving anticoagulants. The difference is modest for an individual patient from 1 year to the next, but over a longer period, even such an effect could influence how cognitive function develops. Our findings suggest that NOAC treatment may also be significant for cognition in this patient group. Study investigator Nanbo Zhu, researcher at the Department of Neurobiology, Care Sciences, and AI stethoscopes may aid early CVD detection. The goal of AI is not to replace healthcare professionals, but to enhance the tools they use, helping them rely on clinical judgment to detect what the human eye may miss. One of the most promising examples of this potential is the AI-powered stethoscope. This is supported by the most recent evidence. Last February, a study published in European Heart Journal, Digital Health demonstrated that a digital stethoscope with AI more than doubles the sensitivity for detecting moderate to severe heart valve diseases in a real-world clinical setting, compared with a conventional stethoscope. To explore this issue further, El Medico Interactivo, part of the Medscape Professional Network, spoke with Jeffrey Lin, MD, board-certified cardiologist and chief medical officer of MD-VIP, a national network of primary care doctors. The expert noted that key cardiovascular diseases, such as asymptomatic atrial fibrillation, AF, heart failure, HF, and valvular heart disease, VHD, are still underdiagnosed. This is due, in part, to the fact that these conditions can be difficult to diagnose using traditional auscultation alone. Early detection, typically when the patient is still seeing their primary. AI adoption soars among UK GPs, but confidence doesn't. Just 23% of UK GPs say they would now recommend general practice to a prospective trainee as confidently as they did before AI tools arrived. That figure sits awkwardly alongside the survey's headline number. 52% of GPs now use AI at work, up from 25% in 2025 and 20% in 2024, a threefold rise in 3 years. The 2026 figures come from a research Square preprint that has not yet been peer-reviewed, unlike the 2 earlier waves of the same survey, published in BMJ Health and Care Informatics, 2024, and Digital Health, 2025. However, the pattern it describes fast, largely bottom-up adoption of consumer AI tools, and a profession still working out what that adoption means for its own future, is one GPs and researchers say is already reshaping day-to-day practice. Among the 522 GPs who use AI, ChatGPT was the most common tool, 67%, followed by Heidi Health, 46%, and Microsoft Copilot, 24%. Just over half of these GPs use AI to write letters, and 41% use it for real-time documentation during consultations. Other use cases are also emerging, however. Just under 1/3 of GPs reported using AI for referrals, up from 1/4 last year. Meanwhile, around 1/4 of GPs who use Glofitamab-GemOx shows sustained survival benefit in DLBCL. TOPLINE Glofitamab plus gemcitabine GemOx, was associated with longer overall and progression-free survival than rituximab plus GemOx in patients with relapsed or refractory diffuse large B-cell lymphoma, DLBCL, who were ineligible for autologous stem cell transplant, ASCT. Serious and grade greater or equal to 3 adverse events were more common with Glofitamab-GemOx, although patients received substantially more treatment with the Glofitamab regimen. Methodology: patients with relapsed or refractory DLBCL who are ineligible for ASCT usually have limited treatment options and may have particularly poor outcomes. The Phase 3 SDARGLO trial previously showed longer overall survival with fixed-duration Glofitamab plus GemOx than with Rituximab plus GemOx. This analysis assessed efficacy and safety after 3 years of follow-up. Researchers conducted a global, Phase 3, open-label, randomized trial of 274 patients with relapsed or refractory DLBCL who were ineligible for ASCT and had received at least one prior systemic therapy. Patients were randomly assigned in a 2:1 ratio to receive either Glofitamab plus GemOx, N equals 183, or Rituximab plus GemOx, N equals 91. Patients in the Glofitamab arm GP advice service linked to incidence of patient harm. Evidence suggests a system designed for GPs to seek advice from specialists before or instead of referring patients to hospital has contributed to harm, missed diagnoses, and delays in cancer care, according to an investigation. The Health Services Safety Investigations Body, HSSIB, identified patient risks linked to how advice and guidance, A and G, services have been implemented across England. A and G was brought in to slash unnecessary hospital visits and reduce waiting times, allowing family doctors to seek specialist input before making referrals. The service has positively influenced patient care by improving communication between GPs and consultants and enabled efficient specialist input into care, the HSSIB said. However, the investigation found evidence that A and G had contributed to near misses and incidents of patient harm, both physical and psychological, where it had been poorly implemented or monitored. The report said harm had arisen as a result of delayed or missed diagnoses and delays to care and treatment. It added, evidence demonstrated that A and G services were being used in some pathways where general practice had requested specialist assessment for suspected cancer. GLP-1 patient with a belching problem, singing may help. Many of the side effects of GLP-1 use are well known. Gastrointestinal, GI issues, muscle loss, etc. They've been well researched, but a lesser-known result of the weight loss drugs is gaining attention, and it would not please the etiquette police. Chronic supragastric belching, characterized by frequent, persistent air intake and expulsion without reaching the stomach, can significantly impair a patient's quality of life. While often overlooked, this condition is gaining clinical attention, particularly as primary care providers, PCPs, manage an increasing volume of GI complaints in patients using GLP-1 receptor agonists. Carol S. Murakami, MD, of Kaiser Permanente South Bay and Harbor City, California, said data on belching among patients using GLP-1 receptor agonists remain limited, but one study of semaglutide reported belching in approximately 11% of participants. If belching occurs 3 or more days a week for at least 3 months, it is considered abnormal and should prompt further evaluation, she said. However, a recent multi-center randomized controlled trial published in Clinical Gastroenterology and Hepatology offers a novel, low-risk behavioral intervention, structured SING. Stat Plus, Amylyx endocrine drug succeeds in pivotal study. Amylyx Pharmaceuticals said Tuesday that its experimental drug significantly helped patients who experienced sudden drops in blood sugar after bariatric surgery, paving the way for its potential approval as the first treatment for the condition. In a Phase 3 trial of people with post-bariatric hypoglycemia, or PBH, those taking the drug experienced a 55% reduction in the rate of serious low blood sugar events compared with those on placebo. This was better than expected. The study was statistically powered to show a 35% improvement over placebo. A serious event is a medical emergency that could mean the person loses consciousness or experiences a seizure. So, any reduction in these hypoglycemic events would be very meaningful for people with PBH and their families, said Amylyx co-CEO Justin Klee. To see such a large effect in the study is just so exciting. This article is exclusive to Stat Plus subscribers. Unlock this article, plus daily coverage and analysis of the biotech sector, by subscribing to Stat Plus. Already have an account? Log in. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.